Steve, I want to thank you for coming in and spending time here with us to share from your knowledge, from your expertise in training therapists around the world, in doing your own therapeutic work throughout the years with other individuals, and in having studied with Milton Erickson to help us better understand what this is about, this idea of utilization.
I'm glad to be here. It's, you know, I think the one thing that everybody, one of the most amazing thing about Erickson is how many different viewpoints there are by his different students.
Yes.
And yet at the same time, the one thing that I think there is uniform agreement that the hallmark contribution, the really unique thing about Erickson's work that forged new ground was this principle of utilization.
Yeah, I think so much so. If a person doesn't understand or isn't able to do utilization, probably not an Ericksonian therapist.
I totally agree.
Okay.
Yeah.
So what is it? In the simplest terms possible, what is utilization?
Well, to me, I mean, there's sort of two complementary dimensions. The first is there's a creative acceptance before you start doing something. There's a way of opening up to completely receive and make room for everything, the totality of a client's identity, their emotional identity, their patterns. Okay. Then you're sort of sifting through and being curious of all these patterns, which might be most important to make use of. If we don't include them, they're going to sabotage. Which would be most interesting and motivational to use those for the positive purpose of furthering the therapeutic aims.
Can you give us a concrete example of that?
Well, one of the great teaching tales from Erickson, it's so lucid about utilization, and like many of these Erickson stories, it's funny, so funny that oftentimes we don't pause to really look into what's happening there.
Okay.
1950s, secretary here in Phoenix, large office, comes in. She announces, I'm going to kill myself. Erickson says, why? She opens her mouth, points to a large gap between her teeth, and says, isn't it obvious?
Okay.
And Erickson said, what's obvious? This gap in my teeth means that I'm so ugly, which means no man will ever desire me, which means I'll never get married, which means my life will have no value, which means I should kill myself. Yeah, isn't it obvious?
Yeah.
And Erickson, rather than saying, oh no, it's not so bad, you know, you have a good personality, or maybe if you smile like this, he said, well, before you kill yourself, I'm wondering if you're willing to make a few commitments to follow a few tasks, I suggest.
Wait a minute. Before you kill yourself, so he's even kind of accepting this statement that she's going to kill herself.
Yeah, so it's like, I trained in the martial art of Aikido for many, many years.
Yeah.
It's the idea that the client is presenting something and you're never trying to block it, you're trying to join with it. And I think that would be sort of the somatic model of it. She agrees. He said, all right, the first thing I want you to do is I want you to go home after work, and for a couple of weeks every night, I want you to practice taking glass of water, fill your mouth with it, and learn how to squirt water through the teeth. She was a little bit shocked, but he said, you made a commitment.
Yeah.
She practices for a couple weeks. She comes back and she's a sharpshooter. Erickson finds, and here's a comment about you're utilizing in the direction of the therapeutic goals. He has a sense that she would like to have an intimacy relationship.
Okay.
He has a conversation with her and discovers there's a young single man in the office who might be interested in her, because every time she goes to the water cooler, guess who shows up?
Yeah.
Second task, I want you to watch when that young man goes to the water cooler. When you see him making his way there, I want you to run up, fill your mouth with water, step behind the wall. When he leans down, you jump out and give him a good squirt.
Okay.
So she does. She's, again, a little bit shocked. She does it. He leans down. She jumps out and squirts him. And then he says, and run like the devil.
And then run like the devil, he tells her to. Okay.
That's right. So she gives him a squirt. He runs after her. He asks her for a date, and as in a lot of these Erickson stories, they get married shortly thereafter and have 6 little water squirters.
So this was we get the happy ending, but this was a very flirtatious thing she was doing. He was kind of showing her how to get someone to pursue her. And the key element in making it work was the symptom she had brought in, where what she considered the symptom was this huge, terrible gap.
Well, my understanding was, like, I could be wrong, but just from reading it, I don't think she was flirtatious. I don't think she had the belief that she was attractive enough to be able to do something like that. But it was clear from what she was saying, because I will not have an intimate relationship, then my life is meaningless. I think that indicates what the value is. And so he's now curious, how can we make use of this?
Right.
And how can we make use of this that would move her in that direction of possibly having an
the
intimate
idea being
relationship?
before then, if she had been flirtatious before then, she wouldn't have a problem. She didn't know how to, and she had this huge burden and had no clue how to make this work.
And I think she had this self-image that this gap in my teeth means I'm so ugly that I could never have an intimacy relationship. So, like many of those Erickson stories, it's funny. But the interesting thing is he's sort of sifting through, and one of the most significant emotional parts of the client presentation is gap in the teeth. I don't think he really judged whether it was positive or negative so much as this has emotional value. And therefore, that's the use of that in terms of a piece of the therapeutic development would really give it motivational value. It would place the change process in the client's own language, which I think makes a big difference. It would interest the client a lot more. And I think there are other things about it that we can talk about. But it's a sense of whatever you're experiencing, whatever value you have, whatever life gives to you, it is upon that rock that you shall build a happy life. That is, I think, the really radical, generative attitude that underlies the utilization principle.
So now you're talking to us about what makes the utilization principle, what makes it therapeutic in and of itself. This is why this is important to do this.
Well, because of the values, and then you also have the fact that, here's every client, by definition, there's some place they want to get to. They might not even be willing or able to clearly articulate that, but the purpose of the therapeutic conversation is to move them in a positive direction. But by definition, when they come into therapy, there's something that is blocking them. They can say, well, I'd like to have an intimate relationship, but as they move towards that important life goal, is that something is coming up. So the question is, what's your relationship to these inevitable obstacles that arise on the therapeutic path? And Erickson made this very radical orientation to welcome them and be curious about how they can contribute to it, so that you don't see them as a problem. You see everything as a potential resource.
Everything is a potential resource, including the symptoms, including resistance, including fear, everything.
I mean, his written case studies are replete with, all those things about the little boy who stomps his foot, and the single mother says, you see, I can't do anything with them. Now, if that boy were brought into a clinic these days, in most clinics, he would be mandatorily medicated. And he would be given medicine, and the whole approach would be to really snuff out that stomping foot.
We're going to eliminate this from your repertoire behavior if we can.
Yeah, and so Erickson said, mother waited out in the waiting room and said to the boy, "Is that as hard as you can stomp?"
Yeah.
A big boy
Yeah.
would be able to stomp a lot harder.
Yeah.
And the boy said, "Oh, I'm a big boy." And he said, "Well, I don't know if you're a big boy. Big boy could stomp that hard at least 50 times. And the boy said, "Well, I'm a big boy." He says, "Prove it."
Yeah.
So now the stomping foot is not seen as the behavior that must be eliminated, but it's how is that stomping foot a pattern that really can get the movement going towards the therapeutic goal.
And become valuable. This idea of him
That's right.
proving he's
That's
a
right.
big boy, which involves some responsibility and
That's right. And I think that is a therapeutic value
okay.
that we're trying to transmit, that everything in your life has positive value.
Okay.
What is required is some sort of positive connection to it.
Yeah.
And so the utilization principle really is such a deep demonstration of that. So not only does it allow you to make use of a specific behavior, a specific value, but I think it's one of the sort of pedagogical things, psychoeducational things that we're trying to help our clients to learn.
Okay.
That everything that life gives you has a potential positive value.
This is a concept. With the problem they bring to us, we can use this as an opportunity to
Absolutely.
get this idea across to them.
Absolutely, absolutely.
Okay. And from that, I assume, comes a life of more abundance and of a readiness to face challenges and thrive.
Yeah, and I think I asked people this question a number of times. If you had a reasonable confidence that whatever happened in your life, and including some really nasty stuff, that if you had a little bit of time and you could struggle a little bit, you could figure out that whatever this experience was, it could help you to be a happier, better person. Do you think that would change the way that you live your life? I've really never met somebody who said no. That wouldn't be a game changer.
It's a great question.
So then, there's a question, yes, but how? And a client develops these beliefs, I can't deal with a lot of life challenges, so I have to start to defend, disconnect, dissociate, limit myself, not take risks, and so forth.
Okay.
So that's, I think, that attitude that was sort of emanating from that principle of specifically utilizing certain elements.
Okay. So I'm about to put you on the spot a little bit. When we've got people that are brand new to Ericksonian therapy, they're studying it for the first time, they're reading these brilliant case studies from Milton Erickson, or maybe some other people that are up there teaching and describing these very creative, very impressive things they do. And this new student gets the feeling, oh my God, how am I going to do something like that? And especially when I'm on the spot. So here we are, maybe something serious is going on, the person's suicidal or whatever. There's no gap in the teeth for me to talk about. So how am I going to know how to utilize this? So I was wondering, could I just throw something out at you as if I was the client, and then you kind of show us how you utilize something on the spot?
Okay.
Okay. So we've got you were talking earlier about you want to go to the where there's a strong emotional value, or where the person's put a lot of emotional energy. So let's say I'm a young woman speaking to you, and at least 3 times in the session I throw out, "I'm so stupid," and in the middle, "I'm so stupid," and it becomes apparent that there's a lot of emotional energy in this. Is that something that can be utilized? And then how do you know what to do with that?
So I just want to say to you, ask this one.
Yeah, of course.
Say, I hear that presence inside of you that really believes that she's stupid, and I want to thank her for introducing herself into the conversation. I just want to say, hi, welcome.
Okay.
I'm really, really appreciative that you have trusted this conversation enough to introduce her.
So the first thing you do, you accept. That's the very first thing.
Absolutely. And if you notice, you're putting the negative behavior in the third person.
Oh, yes.
You know, and I think it's one of the things we learned from trance, that an experience could be represented in first person. I am stupid, which sometimes I think that's the better way to go.
Yeah.
You know, I'm claiming this, I'm speaking this. But other times, because they're sort of learned, usually emotionally younger ego states is the term we use.
Yeah.
And to think of it in the third person. So among the multitude, you know, multiple contradictory parts that live inside of you, there's a presence that really believes she's stupid. I'm sure that makes sense. And I'd like to say to her, welcome.
You said thank you, yeah, and thank you for bringing her here. And so you're implying there's some value here. So rather than this is something we have to eliminate and make no longer exist, this is something you're going to help her discover what value there is there.
And I often will ask after something like that, a person says something like that, I say, I'm just curious, when you heard me say welcome, what happened inside of you? About 90% of the time, people say something's relaxed. Isn't that interesting? So when we talk to that presence inside of you that really feels stupid, with respect and kindness, she relaxes. Isn't that interesting? Don't you find that interesting? So, and you notice again, we're beginning to differentiate the sort of what I would call the competent present age ego self from these different emotional parts, some of which may believe they're stupid or they're unlovable.
Yeah.
And so, to me, what we're thinking, we're opening this conversational space in which we realize inside of every human being, every client, every therapist, the whole universe is there. There are parts of me that think I'm stupid, there are parts of me that love to play, there are parts of me. And usually if we're just up here, it's sort of we get one truth per customer. I'm either stupid or I'm not.
Okay.
But in this conversational space that we're looking to open therapeutically, there's room for multiple contradictory parts.
And that's more likely to happen in a trance state. Is that what you're saying?
Transinformed conversation.
Okay.
The idea here, if I might just take a moment, I think that underlies this, sort of the theoretical underpinning.
Yes.
Is that we're really looking at a two-level theory of reality or experience construction. We've got this first level of sort of primary process, and it's sort of almost like a dreamer world in some ways.
Now, by primary process, you mean sort of like unconscious thinking and stuff, or what do you mean by that
the
word?
term unconscious would be used for it. It's like when you go into reverie, when you go into just letting your imagination, when you go into a dream.
Okay.
That's sort of a non-linear, experiential, symbolic sort of patterning.
Okay.
We say in that place, things are not fully human yet. So they're in this, what, in philosophy of language, is the difference between a symbol and a sign. A symbol is something that Eugene Gendlin used to say is something that has multiple contradictory meanings, a number of which cannot be made explicit.
Okay.
So this part of you that feels, I don't know, it may have 100 different faces, 100 different meanings, some of them positive and some of them negative. So at this unconscious level, it's not locked into any particular form or any particular value. It takes the second level, the observer level, which is the social cognitive mind. It's responsible for this reality out here. It's a different world. It's sort of navigating by these certain rules. Originally, that social cognitive world is your family. You don't really have the maturity when you're a kid. So it's really, how your family and how people when you were a kid defined those parts of you. So it's the human connection to that unconscious sort of multi potential symbol that collapses it or makes it, translates it into a single particular sign. Like, I'm stupid and it's bad and that part of me is not acceptable in the outside world. So my interest would be, how can we welcome that part that feels I'm such an idiot, and realize that's one of the most important parts of your creative self. You realize, I don't know, most of the things in the universe I have no idea about.
Yeah.
And, most of what I say is what the Irish call blarney. It's, excuse me, I hope it's not too coarse, it's bullshit.
Okay, okay.
But you want to be a centered, responsible bullshitter.
Okay.
And realize that most, to me, is one of the greatest conspiracies is that people know that they don't know most of anything.
Yes.
They know that I feel, there's a part of me that feels like an idiot, but the conspiracy is nobody else feels that way. Therapists, I think especially, I've been trained, I went to a graduate program.
Yeah.
I'm supposed to be, able to do this utilization stuff. I'm supposed to know. But the type of language we're working with in therapy, a lot of it is so indeterminate. You have to be able to be comfortable in this not knowing state.
Not knowing, okay. And
so out of that, if you're comfortable, you can hold those things. And I think if we get back to that Erickson gap in the teeth, I'm very confident, although I didn't ask him about this case directly, but I'm just sure that squirting water through the teeth was not the first thing he thought of. That he was able to take those patterns and hold them into this state of curious not knowing.
Yes.
And sort of like holding a jewel and watching it refract into, so many different ways. Oh, it could be this, it could mean this, it could mean this, it could mean this. And then see, squirting water through the teeth, I have a therapeutic intuition that might be something that would be an interesting alternate relationship to it. Even then, you don't know, because it's got to be ratified. It's a negotiation process.
Yes.
But I think that's something that sort of brings a little twinkle. It brings curiosity. You're not in that sort of conditioned sense of, I know what it means, it always means this, et cetera, et cetera. You want to tweak that understanding. So a therapist, I believe, it's really important to train yourself to be comfortable with not knowing.
You have to be comfortable with not knowing.
Absolutely.
With the uncertainty that comes with someone coming into your office and you don't know what will work and you don't know exactly what they'll need.
Absolutely.
But you begin with this position of acceptance. You're looking for what you can utilize. And sometimes, in a sort of paradoxical fashion, you may have them do more of something that's the problem, such as stomping or whatever.
Yeah.
But that gets us to a process of change.
Yeah, it gets us to a process where things aren't being in a rigidly automatic conditioned way. Now, let me add, by that I don't know state, it doesn't mean that you're just sort of wallowing.
Okay.
You need to have this discipline of a balance. So you've done all of the training.
Yeah.
So you know how to run a basic session. You know how to sort of play the basic chords. You know how to do the basic stuff, but you then have to open a space to go beyond any sort of basic plus, which is really where the significant transformational work is. And with clients who have significant symptoms, you can't just do manualized treatment. So you have to do the manualized in the sense of, I've got my way that I've trained to be able to conduct a session, but I know that there are going to be these inevitable points in the therapeutic conversation where I don't know.
Yeah.
And hopefully you train yourself, and then you can train your clients. That's where the interesting stuff happens.
Talking about some modest confidence. And so when you were talking about that space, it made me think of some research that's, and there's many different, it's not just one study that was done. It's been done many times, many different ways, where they look at doctors, the MDs, they look at therapists, they look at different people who have to exercise professional judgment and opinion. They look at how confident these individuals are and how good they are, essentially, and then they measure the outcomes.
Right.
And the consistent finding is the people who perform worse tend to have the highest opinions of themselves. So I know what to do with this one person. I have all the answers. I have it figured out from A to Z, and this is what'll happen. And then, then the person assumes that the therapy was exactly what this person needed. So they're very confident. They're the most confident in their outcomes, most confident in that they know what to do. And when you look at the outcomes and measure them, they actually perform the worst.
I've heard Scott Miller
say the same thing.
A sort of researcher.
Second worst is going to be the people who believe they're no good as a therapist, have very low therapy self-esteem.
Yeah.
And then the people that perform the highest believe they have modest or moderate ability, that they can do average good. And so there's sort of a modest confidence there, and they tend to get the best outcomes.
Humility is endless. So yeah, it brings up a lot. We have this brief time here, but I think, it goes to say that it's not just some mechanical technique.
Okay.
It's a way of again, I think you're looking in terms of any sort of creative development. So you've got this period of stability where you can kind of do versions of what has worked before. But you always come to these places where what you've done before won't allow you to go forward. And those are the times when people are coming to see us, at these sort of transitional spaces where I'm a different person. I'm divorced, or I'm married, or the kids have left home, or I've got this illness, or I've lost a job, or those are the places we know are the statistically the most likely places where people develop medical and or psychological symptoms. So they're in a place where their old self can't get the job done.
Yes.
And so we're not sure what the new self is going to be exactly, but I think what we can do as therapists is hold a container where we can keep a person connected in a good way to what their positive values are, what their competencies are, and then open this space where there's some sort of creative transformation that needs to occur. And I think that we are experts on how to hold that space with people, and then to invite them to listen to their own creativity, not as the singular thing, but as one element of the therapeutic conversation. And for me, been doing the trance work for over 40 years, and Erickson, I think, evolved into this, what in his last stage was calling the conversational approach.
Yes.
I do very short chunks, and I like to have the person's sort of cognitive conscious mind involved, with a lot of reference to somatic felt sense, which I think keeps the mind-body connection going. And then there are these places where they just need to step back and turn it over to their other creative self, just in a small, contained way. And you really want to make sure that, especially if there's trauma history, that they can't go too far astray. And then they dip in and you ask them what they learn. And that is teaching them, I need these little junctures where I don't know the best relationship to this part of my experience, but I can open this little space, and I'll need to, where I can say, what I say is teach me, teach me. I need to learn some new way of valuing it. So we could talk about a few other things, a few other examples.
Well, we've sort of reached the end of our time, but before we finish, what I would really like to do is get at least one or two comments on you. We've been talking about shining the light of utilization on the client. Any room here or anything you want to say about utilization of the therapist or of the therapist's own experiences or shortcomings or problem or any of that?
I believe, I mean, I think what made Erickson such an extraordinary person, this was something my other main mentor, Gregory Basin, would say, is that you are equally an observer and a participant. And so everything that you're asking your clients to do, you go first.
Okay.
And so you're modeling for them a lot of different things.
Yeah.
So it's not I'm focusing all on you, but I'm looking to connect with you there and allow what's happening to really show up in me. So a lot of times I'll say, wow, when I listen to that, this starts showing up in me, and I start feeling this and that. And I just find that interesting and just wanted to share that with you. And I wonder what's happening for you. So we have this sort of conversation between all the stuff that's going on with me, which includes, you know, some not socially like front self stuff, you know, and I think,
I'm not trying to impress you by saying these things.
yeah, and there are things that might be, you know, stuff that you wouldn't normally talk about. I mean, there is therapeutic boundaries that have to be respected that really vary tremendously from client to client. You know, in therapy we call this self-disclosure, and it's quite a range.
Okay.
But I always think if I'm going to ask you to share parts of yourself that are different from your social mask, I need to be willing to do that too.
Okay.
And to know that any genuine, authentic therapeutic process requires that I do that first with myself.
All right. Well, Steve, thank you very much. It's been very interesting.
Great. Thanks, Dan. Yeah. And I really am so grateful that you're doing this project, because for many of us, you know, I've been a psychologist for decades, and this work has so deeply informed not only my professional work, but how I try to live as a human being. And because of that Erickson legacy, where it's so sort of creatively unique, it's a little harder to really try to articulate this coherent underlying framework. And I know that that's what you're trying to do in this project. So to all of you, I hope you can study it all, because it is such a humane, generative approach that I hope that you can become part of it too.